Hello everyone, welcome back to my channel. I'm going to start sharing how to approach MCQ for medicine surgery, option gynae, pediatric, a little bit of psychiatry and statistics. Let's read the first questions. 77-year-old man present with shortness of breath and right-sided chest discomfort. A chest X-ray shows that right-sided pleural effusions and thoracic stenosis is performed and pleural fluid sent to the laboratory for evaluations. The results are as follows. Pleural fluid protein to serum protein ratio 0.7, pleural fluid LDH to serum LDH 0.8, glucose is 45 mg per deciliter. Which one of the following is the most likely underlying cause for this pleural effusions? And the options are congestive heart failure, hepatitis cirrhosis, autoimmune hemolytic anemia, malignancy, and nephrosis. So when we see the pleural fluid analysis interpretation, most of the examiner asks about the cause of the diagnosis based on the pleural fluid analysis. So there are two types of pleural fluid analysis, and if you know the types of pleural fluid analysis, you will know the cause or diagnosis. So these are the two types of pleural fluid analysis. These are Transudate, Exudates. The cause of transudates are congestive heart failure. Not all congestive heart failure can occur transudate. Some occurs exudate according to the associations associated factors or precipitating factors. So just remember as an exceptional, but I will not note it down here. So the second one is cirrhosis of liver, and is the kind of transudate, and the third one is the renal cause like nephro cause, and it's a transudate. So some from the X-rays are malignancy, infection like pneumonia or TB, like pneumonia, TB, and also PE. It's a pulmonary embolism, can also cause the X-ray, and rheumatoid arthritis is also cause the Exudate. So over here, when we see the pleural fluid analysis, we need to know the LAT criteria. We have to apply LAT criteria based on the pleural fluid results to know whether it is exudate or transudate. So let's read the LAT criteria. Exudate is likely if one or more of the following criteria are met. Pleural fluid protein is to serum protein ratio more than 0.5. Pleural fluid LDH is to serum LDH ratio more than 0.6. Pleural fluid LDH more than 2/3 of the upper limits of normal serum LDH. So this is our interpretation, is that pleural fluid protein to serum protein more than has to be 0.5. It's so here it's 0.7, so one criteria met, and this has to be 0.6, right? So this is 0.8, so the second criteria met. So this is obviously exudate. So this is the transudate, and hepatitis cirrhosis occur transudate. One of the functions of the liver is storage of the albumin. So in the chronic liver insufficiency or chronic liver disease, albumin cannot be stored, and then due to the liver is malfunctioning, so hypoalbuminemia occurs, and that hypoalbuminemia leads to the increase the hydrostatic pressures and decreasing occulted pressures, and which can cause the ascites of pleural fluid effusion. So this is a transudate. And also autoimmune hemolytic anemias, RA, rheumatoid arthritis, is one kind of autoimmune hemolytic anemia. But if the examiner wants us to choose or wants the diagnosis as a rheumatoid arthritis, obviously the gender of the patient has to be female, because most of the rheumatoid arthritis patients, women are more likely occur the RA than men, RA than male. So, and also it has to be applied ABCD criteria. It's written in the OACM, Oxford Handbook of Medicine, clinical medicine. It has to be written about the ABCD criteria, so you can read it, and so it has to be given like such criteria has to be met to choose the RA. So over here I is out, even though this is exudate. And also malignancy and nephrosis. Malignancy is exudate, and nephrosis is transudate. So this is malignancy. This answer has to be malignancy because of the malignancy is also exudate, and that the glucose results in malignancy range is between 30 to 50 sometimes. Yeah. So it has to be malignancy is the answer. And thank you so much for watching my short videos, and I will try to make it more short video like this to improve your study. Thank you so much.